I would like to focus our work on three major areas. One, cleanliness of public spaces. Two, personal hygiene. And three, social norms. For this, we have formed a SG Clean Taskforce under the preview of the Ministerial Task Force to drive this. I will chair this SG Clean Taskforce. It will comprise colleagues from various ministries, including MCI, MSF, MOE, MND, MOT, and MCCY, and also representative of other agencies. What we know now is that from our research from the National Center for Infectious Diseases and DSO National Laboratories, I think is published in today's papers, is that the environment contamination is an important factor in the transmission of the coronavirus. But it is also found that it is easily disinfected. This underscores the importance of cleaning our public high-touch areas regularly. But ensuring cleanliness of public spaces is a common and shared responsibility. The government will put standards in place and take enforcement action where they are not met. For instance, since 30th January, SFA and NEA have been conducting joint inspection at hawker centers to remind operators to maintain high standards of their operations. We have been also inspecting public toilets. We want to ensure that soaps are always available for public to use and not diluted, to make sure that they have access to soap to wash their hands. And therefore, we want premise owners to maintain the highest standard possible in the facilities they run. At the same time, I'd like to remind ourselves that all of us have the responsibility to use these spaces, maintain the hygiene standard that required of us. We started the SG Clean campaign last month on 16th February. I'd like to update where we are now. NEA and SFA has been engaging stallholders, hawker centers, coffee shop owners to be part of the SG Quality Mark certification program. Other agencies have been involved, including ESG, STB, MOE, LTA, and MOT, to work in their with the respective stakeholders to uplift the hygiene standard of premises, such as retail, hospitality, transport, nodes, schools, and childcare centers, so that at the end of the day, they are also all SG Clean certified. What we'll do now is the members of the SG Clean Task Force will ensure that we will raise the awareness of the importance of maintaining the hygiene of these places, to make sure the cleaning standards are maintained, and also audit the places that have high public touch and traffic. At the same time, we'll be amending the Environmental Public Health Act, as announced in our newer COS recently. This new regime will put up standards for public cleanliness. For example, frequency of cleaning, disinfection of high contact areas, particularly toilets, pest management and dengue management regime. And I have to emphasize here that as we continue our fight against COVID, we must remind ourselves that dengue is endemic in Singapore, and we must not let our guards down. Recently, we are quite alarmed that not only the breeding of mosquitoes have increased, the number of hotspots of dengue infection have also increased, but dengue3, a serotype not common to Singapore, is more common now than ever before. The other thing the EPSA will also do is to ensure that our premise owners will also take care of some of the neglected areas of cleanliness, like back of house. So this will have standards for them to comply to. At the end of the day, we want greater accountability on premise managers. which means that premise managers will be required for some of these premises to appoint a designated person who will be responsible to manage, maintain the cleanliness of all these areas. And for the moment, for a start, in 2021, we will be focusing on areas where there are immuno-vulnerable occupants, such as childcare, schools, elder care facilities, and hawker centers. The SG Clean Taskforce will coordinate these efforts.